Hello friends, I'm Dr. R.K. Dua. I am a founder of Fun, Learn and Earn system for the dentist. So in the last video, I have discussed how we can examine the swelling by doing the inspection. So by now you must be knowing that inspection is only by seeing the swelling or any lesion with our eyes without touching the patient or the swelling. So all those findings which we have observed during the inspection, we have to confirm those findings with respect to site, size, shape, mobility, skin surface, attachment of the skin. So before going for any palpation of the swelling, we must first observe whether the temperature of the swelling or the lesion is increased or not. Otherwise, what will happen if we do this temperature examination after doing all those palpation? Temperature may be falsely increased because of handling of the swelling. So that's why first step should be to check the temperature of the swelling. How we can check the temperature of the swelling? If we directly place our hand over the swelling, it may give false impression, because patient may be febrile and that increased temperature may be false increase in the temperature of the swelling. So first of all, we have to place our hand over the normal part of the body which is not involved in the lesion. So suppose there is a swelling on the right side of the thigh, so we must check the temperature of the left side of the thigh. So by placing the first hand over the left side like this over the thigh, and then placing the hand back of the hand on the right thigh where the lump or lesion is there over the lesion. So first is the temperature, then we have to confirm the site with respect to the various bony landmarks by measuring the distance from the bony landmarks of a swelling: lower margin, upper margin, lateral and the medial. Then comes the size of the swelling. We have to confirm our size with the help of measuring tape. We have to place like this. We have to place two vertical bars on the margin of the swelling, and then we have to check the distance between the two. Not like this, it is a curvature. It should not be like that. Then comes the shape of the swelling, whether it is oval shape or it is irregular in shape. Then the surface of the swelling. So surface of the swelling, we have to check whether the surface is smooth, irregular surface, lobulated surface, and over the surface we have to check whether there are any other abnormal structure present or not. So surface, we can just palpate over the surface and we can make out the irregularities over the surface. Then are the borders of the swelling. So borders of the swelling we can palpate and we can make out whether the borders are smooth or irregular. So then the tenderness of the swelling, whether the swelling is tender or not. Tender means when we palpate, we touch or press the swelling, it is painful. So when the swelling is painful, chances are that it may be inflammatory in nature. Most of the benign swellings are non-tender and they may cause pain when they are into a big size because of compression over the surrounding structures. So then we have to palpate the abnormal pulsation whether are present in the swelling or not. These abnormal pulsation may be the transmitted pulsation. That means swelling is placed over the vascular structure and that vessel can give rise to transmission of the pulsation into the swelling or the lesion. Or it could be some vascular lesion that can give rise to the pulsation. So second and the most important point that can help in the differentiation of the swelling from a malignant and the benign: fixity of of the skin over the swelling, one thing, and fixity of the swelling with the deeper structures. So that means fixity we can check like this, we can pinch the swelling like this. If we are able to pinch the swelling, that means the skin is not fixed to the swelling, and we have to move the swelling in a lateral direction and the horizontal and the vertical direction. So if the swelling is moving over the deeper structure, that means swelling is mobile and it is not fixed to the deeper structures. When the swelling is not fixed to the deeper structures, that means chances of it being a malignant swelling are low as compared to the swelling which is fixed. Sometimes very chronic lesion or the ulcer may be fixed to the deeper structures because of inflammatory changes and later on fibrosis. So any discharge from the swelling on pressing the swelling. So if some discharge is there, some opening is there which opens out on pressing the swelling and it releases the content that may be liquid or may be paste-like structure. So as in case of sebaceous cyst, the patient may give history that when he or she used to press the swelling, there is release of pultaceous material from the swelling that is very foul smelling. So these are the various things that you have to do in the palpation. Palpation means confirmation of the findings of the inspection by touching the swelling and the patient. Thank you very much.